Assalamualaikum. So let's continue with the risk factors regarding bleeding or rectum. So one would be ask about the cigarette smoking and alcohol consumption, red meat ingestion. Those who eat red meat very frequently, they are very prone to large bowel carcinoma. And fatty food, junk food, and low fiber diet. So these are the risk factors. Ask about the previous history of ulcerative colitis, Crohn's disease, and steroid use. Any previous surgery in which there will be ureterosigmoidostomy was done. So at the anastomotic side, there is a maximum chances of recurrence of the cancer. History of biopsy and endoscopy, family history of carcinoma, breast carcinoma, uterine carcinoma, vein carcinoma, thyroid carcinoma, and bowel carcinoma. So these are very important to ask in the history. Ask about the radiation exposure in the past. And like endoscopy, you have to ask about the CT scan, so it's very important. And supersaturated fats, consumption of supersaturated fats, supersaturated animal fat consumption. So these are very important. Continue further, ask about the meds and they also evaluate the system, so systematic inquiry. These are very important. Ask about the anorexia, nausea, malaise, appetite. So these are very important. The second most important thing is weight loss. And regarding CNS, ask about the tinnitus, headache, loss of consciousness, and blurring of vision, water level of consciousness. And with the CVS, ask about the tachycardia and tachypnea. And for the respiratory, tachypnea, chest pain, shortness of breath, pruritic chest pain, hemoptysis. And for abdomen, ask about the ascites and jaundice. These are the two important questions for the abdomen. And for musculoskeletal, ask about the radiculopathy with lower back pain, long bone pain, and joint pain. Then for local infiltration of the carcinoma, ask about the air bubbles in urine, and spillage of fecal material, like loss of the tone of the external sphincter, and passage of feces through vagina or through skin, loss of control onto the fecal material. So these are the very important questions regarding medicine systemic inquiry.